Hi, everyone. I'm Steve Adubato. You recognize the leader we have on camera. She's the First Lady of the great state of New Jersey, Tammy Murphy. Good to see you, Tammy.
And you, Steve. Thanks for having me.
As always. If you could tell us exactly where we are with the Nurture NJ initiative, what it is, remind people, we'll put the website up, because you've been making a tremendous amount of progress with your colleagues on this.
Thank you. So Nurture NJ is an initiative that we unveiled in 2019. Right. The purpose of Nurture NJ is not only to raise awareness of the problems that we have here in New Jersey with respect to infant and maternal health. For those who do not know, we are 47th in the country in terms of maternal mortality rates. And when you dig down, you find that if you are a person of color, your chances of either dying or having challenges from maternity-related complications are significantly greater. In fact, they are over 6 times greater than that of a white woman. And for a baby of color, a Black baby is 3 times more likely than a white baby to die before his or her first birthday. So one cannot, being a mom as I am, one cannot possibly know those statistics and not feel a need to fix our challenges here in New Jersey. Nurture NJ, the goal of Nurture NJ is to both reduce our maternal mortality rates by 50% over 5 years and to eliminate the inequities in birth outcomes. And we're pretty determined to address both of those. We have, I'm not sure how in depth you want me to go, but we have been working at this. We've got thousands of stakeholders with us these days. We host everything from, we hosted our 5th annual Black Infant and Maternal Health Summit. Yes. just in November. We also, throughout the year, we've re-upped our Family Festival series. We've now had 16 family festivals, which is essentially a combination of a job fair and a block party, where we bring all sorts of resources under one roof. So we've started those again. We continue with an Ask Our Expert series in social media, and we have interdepartmental meetings. We're working with the legislature on a number of policy areas. So there's a lot going on.
There's a lot of progress, and as we continue to have the Nurture NJ website up so people can find out more about the initiative and also how they can access some of the services that you're talking about. But one of the things that really struck me, and all the times we've had you on, I picked this up in the notes and getting ready for today, and I've never asked you this. Is it true that most of the deaths, most of the maternal deaths disproportionately among Black and brown women, absolutely preventable?
100%. Yes, they are preventable. They are preventable. So we've done a lot of things in New Jersey to address some of these things. For example, we no longer reimburse through Medicaid for early elective C-sections unless there is a medical need. And I will tell you, this is one of my favorite examples as to where you have good people who are trying to do the right thing, but the outcomes are terrible. If you are a doctor and you say, I'm going to donate my time to a very impoverished area and I'm going to give them, the 3rd Friday of every month, then the clinic where they might go is going to naturally say, this is great. We've got this fabulous doctor coming in. So let's just line up all these women to get C-sections so that we can make sure they get the best possible care. And that's major surgery. And this mom may go home and either have an infection and not go see the doctor. She may go home to a home where she has other children and she doesn't rest. She may go back to work. So there's all sorts of things that happen. And it's not because either the clinic was trying to do something bad or the doctor was, but it's just understanding what the needs are of the community. So that's just a small example. Another one is going into the
That's not a small, Pia, 1 second. I'm sorry for interrupting, Tammy. That clearly it's not a small example, but also, as you said, many of those deaths are preventable. Yes. But it takes a totally different approach instead of let's just do a C-section.
Right.
And exactly. I interrupted you. You were going to bring up another point.
I was just going to say a lot of these things are just common sense. So, we now have a scenario where if a woman presents in an ER room and in the emergency room and they are feeling unwell, they may not look as though they're unwell. And you could have someone come in with, a broken arm or something, and that's obvious. We now require that when a woman presents in the ER, that one of the first questions that they are asked is, have you delivered a baby in the last year? That question can take you to the front of the line. And it's a very simple thing to do. It's just making sure that people understand the importance of doing things like that.
Tammy, I know that the March of Dimes just released some information, which is really important, that talks about New Jersey standing out in this regard. Go ahead.
Yeah, so the March Times released their 2022 report card on infant and maternal health. They go into in-depth analysis across 53 states and territories. Of the 53 states and territories, 47 declined year on year in the United States. 1 remained the same, and 4 states improved. And thankfully, I can tell you that New Jersey is one of the 4. And we improved across all areas of their study, which are, we have better outcomes for preterm births. We have lower cesarean section rates, which we were just discussing. We have lower infant mortality, and we have better prenatal care. So I'm really proud of us. I know that we are onto something now, and we're bucking the trend across the United States. So we'll keep at it.
What is the role, in your view, of the not-for-profit community and not-for-profit leaders in this fight?
Listen, Steve, we have stakeholders across every area in our state. And it is going to take every single person coming together and working on this space in order for us to have the transformational change that is required. And that is not-for-profit sector, it's academia, it's our legislators, it's people like you who are helping us get the word out so that there's awareness. It's truly, it's everybody. The not-for-profit sector is there. Many people in the not-for-profit sector are huge allies of ours and have been real change makers. And we're grateful for every person who shows up and leans in, but they are highly needed.
Before I let you go, you've been taking a national role with the National Governors Association, and you're a national governor's chair, the initiative on maternal and infant health. And I know that the governor, and Governor Murphy, has been very involved with the
Yes.
National Governors Association as well. Could you give us a minute on that?
Sure. So Phil is now the chair of the National Governors Association.
He sure is.
His capacity as chair, he has the ability to pursue an initiative for this upcoming year across the entire country. And I, as his spouse, also have the ability to pursue an initiative. His is tackling youth mental health. Mine is addressing, obviously, the disparities in infant and maternal health. We have already had one convening. We had it in Salt Lake City. We have another one that's coming up in short order in January. And essentially what we are doing is we are working across party lines. We are bringing in experts. We're bringing in people to give lived experiences and share those experiences so that legislators and governors and their staff can hear. We're sharing best practices. We are learning from one another. And at the end of the year, our goal, Phil and I are going to release a playbook that will enable any other state to see what best practices we've gleaned over the course of the year. We will share the work we've done. Phil signed 43 pieces of legislature in this area since he came into office. So there's a lot that we can share, and there's a lot we're going to learn. And thank goodness, moms and babies are beloved by all. So it doesn't matter what side, what party you're in or anything else, everybody is leaning in on both of these topics.
Here at Kane University, everyone gets their chance to climb higher. Michael came to Kane and found his passion for healthcare, and now he's a doctor. After Trisha graduated, her graphic design work was featured in the New York Times. Samantha is studying athletic training and finding her path to an internship with the New York Giants. Real students, real stories, real success. Cougars climb higher. Kane University.
Also brought to you by the Russell Berry Foundation, making a difference. The New Jersey Economic Development Authority. The Turrell Fund, supporting Reimagine Childcare. RWJ Barnabas Health. Let's be healthy together. Kane University, where Cougars climb higher. The Healthcare Foundation of New Jersey. Horizon Blue Cross Blue Shield of New Jersey, here when you need us most. New Jersey Sharing Network. And by Robert Wood Johnson Foundation, working for a healthier, more equitable New Jersey.